The INFORM study looked at joint infection after hip or knee replacement surgery. People with severe osteoarthritis, joint conditions or injury have hip or knee replacement to reduce pain and disability. In the UK in 2019, there were over 200,000 hip and knee replacements. About 1 in 100 become infected. Treatment for severe infection usually requires 2 operations. First, to remove the joint and infected tissue. Secondly, to replace the joint. The patient takes antibiotics in between. However, some surgeons treat the infection with a single operation. This research was needed to find out why some patients get joint infections, how this affects patients and the NHS, and to evaluate treatments. The INFORM study involved different kinds of research. We looked at the results of existing research. We took data from the National Joint Registry. We talked to patients and surgeons to understand their experience of infection. We compared the cost of the different treatments. We asked patients about their treatments and what was important to them. And we compared the 2 treatments with a clinical trial. 140 patients with hip joint infection were treated with either 1 or 2 operations, decided randomly. We then compared how the different treatments affected the patient's quality of life. The key findings from the INFORM study are: joint infection can be difficult to detect, but there are some newer tests of the fluid in joints that might help to make it easier. We found that about 0.62% of hip replacement patients and 0.75% of knee replacement patients developed a joint infection that needed treatment. Patients that needed a revision or redo operation were 4 times more likely to get an infection. Joint infection is more common in men, people who are overweight, and those who already have certain health conditions. Some surgical techniques made the risk of joint infection lower, for example, the posterior approach and ceramic-containing bearings. Patients shared how joint infections badly affected their lives. For example, being unable to move easily and do things they enjoy. Loss of independence, as well as the pain, emotional distress, and the effect on relationships with family and friends. Surgeons described the emotional impact on patients and themselves, and how important it was for patients to have the correct support. The research showed that hip joint infection treated in 1 or 2 operations cleared equally well. But information from the National Joint Registry showed there might be slightly higher rates of unplanned reoperation after treatment with 1 operation, but less operations overall. Our clinical trials showed that at 18 months, the 2 treatment groups had similar levels of pain, function, and stiffness. And there was no difference in the number of patients getting another infection. Over 18 months, the cost for 1 operation was around £36,000, compared to around £46,000 for 2 operations. Recovery was quicker after 1 operation, and costs were about £10,000 lower.